Students, very good morning to all of you. Today I will discuss about the care of patient having alteration in body temperature. So, body temperature defined as the degree of heat maintained of the body, or it is the balance between heat production and heat lost in the environment in the body. And the normal body temperature ranges is about 36.0 degree centigrade to 37.5 degree centigrade, or 97.0 degree centigrade to 99.5 degree Fahrenheit. Sorry, 97.0 degree Fahrenheit to 99.5 degree Fahrenheit. We know that our normal body temperature, oral body temperature is about 37 degree Celsius to Celsius, or 98.6 to Fahrenheit. Okay. So, in body temperature, when there is a heat produced and heat lost in the body, it is the when the imbalance between the heat production and heat lost from the body is called temperature alteration. So here the temperature, why temperature is altered? Because there has the imbalance occurs between the heat production and heat lost. And there are two types of temperature alteration, that is hyperthermia, that is known as pyrexia, and second is the hypothermia. Okay. So when the body temperature, first I will discuss about the hyperthermia or pyrexia. When body temperature raises above than 36.0 degree centigrade to 37.5 degree centigrade, or ranges above than 97.0 degree Fahrenheit to 99.5 degree Fahrenheit. Our normal body temperature ranges is that 36.0 degree centigrade to 37.5 degree centigrade is the normal body temperature range, or 97.0 degree Fahrenheit to 99.5 degree Fahrenheit is the normal range. Okay. So when body temperature ranges above than normal range, that is known as pyrexia or hyperthermia. Our body temperature ranges above than 99 degree Fahrenheit, or 37.2 degree centigrade, that is called also known as the hyperthermia or pyrexia. When body temperature not ranges above than 99 to 100 degree Fahrenheit, or not rises above than 37.2 degree Celsius to 37.8 degree Celsius, that is known as low pyrexia. When body temperature remains between 100 degree Fahrenheit to 103 degree Fahrenheit, or body temperature remains between 37.8 degree Celsius to 39.4 degree Celsius, that is known as moderate pyrexia. So temperature remains between 100 degree Fahrenheit to 103 degree Fahrenheit, and or 37.8 degree Celsius to 39.4 degree Celsius, that is known as moderate pyrexia. When the body temperature remains between 103 degree Fahrenheit to 105 degree Fahrenheit, or 39.4 degrees Celsius to 40.6 degrees Celsius, that is known as high pyrexia. When the temperature rises above than 105 degree Fahrenheit, that is known as hyperpyrexia. When the temperature remains between 95 degree Fahrenheit to 98 degree Fahrenheit, or remains between 35 degrees Celsius to 36.7 degrees Celsius, that is known as the subnormal temperature. Here temperature falls below the normal. Okay. The client who has fever, and that condition known as febrile. Okay. And when the body temperature rises above than 105 degree Fahrenheit, or body temperature rises to 105 degree Fahrenheit, that is known as hyperthermia. When the body temperature falls below 95 degree Fahrenheit or 35 degree Celsius, that is known as the hypothermia. Then come to the there are four types of fever, that is constant fever, remittent fever, and then the intermittent fever, relapsing fever, and others are the irregular fever, etc. So for common types for that is the constant fever or continuous fever, then the remittent fever, then intermittent fever, then the relapsing fever. So see that constant fever. So when the body temperature fluctuates minimally but always remains above normal. When the body temperature remains above the normal, and it will be not varies between more than 2 degree uh, between morning and evening, and that is and not reaches to the normal, that is known as constant fever. Example is the typhoid fever. Okay, then come to the remittent fever. In the remittent fever, there has wide range of temperature fluctuations over the 24-hour periods, and the temperature varies more than 2 degree between morning and evening. Here also the temperature not reaches normal, and the temperature is always above the normal, and temperature not varies 2 degree between the morning and evening. Example is the cold and influenza. So that in cold and influenza uh, disorder, or a patient who has the illness in the cold and influenza, so here the temperature not reaches normal, temperature above the normal, and the temperature varies more than 2 degree between morning and evening. That is known as a remittent fever. Then come to the intermittent fever. So in the intermittent fever, temperature rises from the normal to high fever and back at a regular interval, and greater the temperature is greater in evening. uh, okay, then come to the relapsing fever. Here there is a brief febrile period and followed by more degree uh, 1 or more days of the normal temperature. So relapsing fever, it is a short febrile period of few days. Okay, and period as a last period is 1 or 2 days of the normal temperature. So relapsing fever টা হচ্ছে ଗୋଟେ febrile period, এটা fever patient patient fever patient temperature ବହୁତ high ମଧ୍ୟ ରହିଥାଏ, and ଏହା ମଧ୍ୟ normal temperature ରୁ ଅଧିକ, the temperature is will be higher than normal temperature, and it will be resist 1 or more days. Then come to the a fever spike is there. Here the temperature rises than the normal, then return to normal within a few hour is called the fever spike. Okay, the temperature rises above the normal and return to normal in few hour is called the fever spike. Then etiology or common causes of pyrexia. What are the common causes of the pyrexia? Let's see. Some of the common causes are the when the blood will be infected by the bacteria or a virus. Example the typhoid fever. Any foreign proteins will be taken, that is the taken of the vaccine on the serum, and due to the cerebral hemorrhage. Acute infectious disease, that is the pneumonitis or the pneumonia, encephalitis. Inflammation of the that is so So pneumonitis or encephalitis, these are the acute due to the acute infectious disease, and then it is causes of pyrexia. So pneumonitis is the inflammation of the one or both sac of the lungs, and it is filled with the fluid. And the encephalitis is the inflammation of the brain, then inflammation of the tonsil in the throat, that is tonsillitis. And also if the patient has in the malaria fever, malaria patient is the malaria disease, or that is also developed the pyrexia. And if the patient has the measles, the patient is in the severe dehydration, patient has the rheumatic heart disease or joint disease, patient in the diarrhea conditions, that all are develop the pyrexia or body temperature rises. Okay. What are the signs and symptoms of pyrexia? That is, there are the loss of appetite. Patient is unable to take the food, and patient has the headache, and always because he cannot take restlessness and the delirium conditions. Always he becomes the mind diverted, and he cannot easily cannot understand about the object. If he sees the rope, if he seen the rope, then he will be think that it is a snake, and there is no sound, but he heard the sound. So that type of delirium conditions develop, and patient is feel uncomfortable. That is known as malaise. That is another sign symptom. And there has the constipations. There is a stool become very hard, and the diarrhea. Sometimes patients do the loose stool. And photophobia, that patients always fear to see the light and becomes convulsions stage. There is a on-call discharge of electrical neurons in the brain, and skin becomes red, hot, or dry. And iron output also decreases because the patient is unable to take the food due to the fever, and it does not take proper fluids and much amount of the fluids. Then come to the assessment of the pyrexia. So first is the monitor the temperature is the first responsibility of the nurses. So he or she collect the subjective as well as the objective data from the patient, from the family members. So collect the data, and she monitor the weight and intake, maintain the intake output chart, and maintain and also record a report. Okay. Then come to the management. In the regulation of body temperature, for the control of the body temperature, so various methods are done by the nurses. So room should be well ventilated, provide comfortable position to the patient, and blanket or excess clothings whatever the remain in the bedside, that should be removed because it is prevent the draft. That means the cold air cannot reach to the patient, so that excess blanket excess clothing should be removed. Okay. And other methods are like the provide the cool air by electrical fan, and apply the ice cooler, ice bag, cold compress to the apply the patient from the head to bottom or the abdominal area to reduce the temperature, and apply the cold sponging, cold packs, etc. And also use the hypothermic blanket or mattress, and for that reasons the body temperature also be controlled. ताले ice bag, ice cooler, cold compress आदि apply करिबा patient body रे temperature reduce करिया पई. आम साधारणतः घरे होम थेरापी रे टेम्परेचर रिड्यूस करने ପାଇଁ आम कौन फोरहेड रे कौन हुए ना गोटे हैंड कर्चिप या किसी क्लथेस रे कौन हुए ना किसी वाटर से ऐड करी ताकू पुणी कौन करे वाटर को स्क्वीजिंग करी से ओट पैड को फोरहेड रे रखिले फोरहेड रे रखिले कौन हुए ना बॉडी टेम्परेचर धीरे कमी जाए. तो हॉस्पिटल कौन है से टाइप कोल्ड कंप्रेस, आइस बैग, आइस कूलर आदि अप्लाई कला परे मध्य बॉडी टेम्परेचर कमी थाए. एवं इलेक्ट्रिक फैन द्वारा मध्य पर्सन को यदि इलेक्ट्रिक फैन एक्सपोज करा जाए तो मध्य बॉडी टेम्परेचर कमी थाए. देन कम टू द मीटिंग द न्यूट्रिशनल नीड, वी प्रोवाइड द सेमी सॉलिड डाइट in small amount and also frequent small amount small amount semi solid diet कौन करिवे ना पेशेंट को दबा एवं यह frequent interval दबा अल्प अल्प करिकी ताको इंटरवल सकाळु संध्या जाके बा राति जाके कम धीरे धीरे करिकी जेतिकी खाद्य खाइबा अल्प अल्प खाद्य करिकी बारंबार दबा the dislike foods which is the unfavorable to the client that should not provide जो खाद्य को client चाहिए ना से खाद्य दबा नहीं कारण it is causes the vomiting and due to the there are the coated up or white patches in the tongue and there is a coated of the tongue the client does not enjoy the better taste of the food and mouth will be rinsed because that to prevent the bad smell and soft diet plenty of fluid will be provided then providing the rest and sleep so client who are in which have the temperature greater which has the ranges of the temperature than the normal and the patient who has the in the fever typhoid fever or malaria patient etc that we provide the rest and sleep because rest and sleep will be created at reduce the body temperature because rest sleep is very necessary to the patient so provide complete bed rest and provide calm and quiet environment to avoid the overcrowdings and provide the stop the lighting and on switch on the fans to provide the ventilations change the positions every time every hour okay then maintain the personal hygiene so every 4 hourly mouth care is given to the patient to prevent the bad breath and to prevent the bad taste for the reasons mouth care is given because and to prevent the infection by the bacteria so mouth care न देले कौन हो ना माउथ केयर कहीं दिया जाए ना बैड ब्रीथ माउथ जो आसे सेटा प्रिवेंट करने बैक्टेरिया इन्फेक्शन ग्रोथ होगापी एवं बैड टेस्ट जो माउथ बैड टेस्ट को प्रिवेंट करने माउथ केयर दिया जाए तो माउथ केयर इज गिवन एवरी 4 hourly and apply the emollients like the glycerin borax liquid paraffin and Vaseline etc and that is most beneficiary emollients that will be applied over the leaves to prevent the dry the leaves and always given the care to the pressure point skin area and if there is if there is sweating present that is other that is the by which the clothes will be wet so that the wet clothes or wet dresses should be removed and neat and clean dresses will be wear by the patient and if the sponging is needed due to the proper sweating then sponging should be given if the temperature remain high then cold sponging is given to reduce the temperature okay then safety factor never leave the client alone because sometimes rigor will develop the sudden severing of the client will be the client sometimes as the temperature rises the client suffering from the rigor rigor is the severe that is the severe severing so it is a sudden severe attack severing where body temperature rises rapidly it is seen in the malaria case okay so sometimes rigor will be developed and convulsion also be developed so that be careful to observe the patient conditions and for that reasons all the articles should be placed in the bedside of the patient And also we apply the cold applications as it is the needed. So to reduce the fever, antipyretic drugs such as paracetamol should be also provided. When the temperature goes down, the plant should be protected with warm blanket, given the warm blanket after reduction of the temperature. So cold blanket ଦେଲେ warm blanket ଦେଲେ କ'ଣ ହେବ, ଯେଉଁ ରାଇଗର ହେଉଛି ତ ବଡି ଟେମ୍ପରେଚର, ସୋ ରାଇଗର ହେଲା ପରେ ବଡି ଟେମ୍ପରେଚର କମିଯାଏ, ତାପରେ ଆମେ warm blanket ଦେଇଥାଉ. Then come to the observation of the skin. Check the vital signs, that is temperature, pulse, respiration, blood pressure should be checked. Measure and evaluate the urinary output periodically. Then the caring of the rigor. So rigor is characterized by the three stages. First is the fast or cold stages, second are the hot stages, third stage or sweating stages. So fast or cold stages, what are the signs, symptoms appears, and what type of care should be given. So in the fast or cold stages, the patients there are sudden attack of the severing to the patient. So client severs uncontrollably. Here the skin becomes very cold, and face becomes very thin and pale color, and pulse is very weak. So temperature suddenly rises above than 100 rises to the 103 Fahrenheit or than above. So at that time, cover the plant with a blanket or warm blanket. Apply the hot water bottles, give hot water drinks, and protect the plant from falling. Then the second or hot stage. In the second or hot stages, what happen? The plant feels very thirst, and so that plant want the water. So at that time, remove all the blanket and gives hot applications, hot water bags, bottles, and cover them with only a thin blanket, because here the plant is very thirst, and so that a thin blanket should be given, and give the cold drinks, cold compress should be also apply, and record the temperature pulse every 10 to 15 minutes. If the temperature suddenly high, then give the cold sponging. Okay. Then come to the third stage or sweating stage. Here severe sweating occurs, so that wearing gowns, dresses, and all the bed linens should be wetted, and these are the wetted by the sweating. These are wet by the sweating. So change the clothes that are wet with sweat, and provide the neat and clean clothes to wearing the patient, and put clean clothes and sweet drinks should be given to the patient, that is to treat the tiredness or the fatigue, and take temperature, pulse, respirations, or measure the vital sign like the temperature, pulse, respiration, or TPR every 15 minutes. When the temperature comes down, when pulse is not improved, and then it is known as the pulse crisis. At the time, plant conditions is not better and it become deteriorate, so that at the time careful observed. Then record the date, time, name, dose, and effect of the drug. Then come to the hypothermia. Already I said that when the alteration body temperature falls below the 95 degree Fahrenheit or 35 degree centigrade, that is condition of the hypothermia. When there is excessive heat loss, that is sunstroke, example sunstroke, that is in the hypothermia, that is a body temperature falls below the normal, that is 35 degree centigrade or the below the 95 degree Fahrenheit. When in the body there is has the excessive heat loss, and there is then inadequate heat production, that is impeding the thermoregulation pattern, that causes the due to that, that is a physical mechanism by which body there is a physical mechanism that develops the hypothermia condition. But causes are like the due to the any surgical during the surgical procedure, body from the body heat will be lost, and at the time temperature will be reduced and oxygen needed. And in the types of hypothermia, first is a mild hypothermia, moderate hypothermia, severe hypothermia. In the mild hypothermia, when the temperature uh, remains between the 90 degree to 95 degree Fahrenheit or 32.2 to 35 degree Celsius. The moderate hypothermia, uh, in the mild hypothermia, patient becomes conscious but alert because becoming confusion. He do not known about the time, date, place, etc. Patient becomes shivering, and the temperature remains between the 9 to 95 degree Fahrenheit or 32.2 to 35 degrees Celsius. In the moderate hypothermia, there is a conscious levels become decreased and patient goes to coma, and there is a decrease pulse rate, that is bradycardia, slow respiratory rate, and decrease the blood flow in the kidney or renal. The temperature remains between the 87 to the 90 degree Fahrenheit or 30.6 to 32 degrees centigrade. In the severe hypothermia, there is a temperature less than 87 degree Fahrenheit to 37.6 87 degree, less than 87 degree Fahrenheit or less than remains below the 37.6 degree centigrade. Here patient goes to the uncontrolled shivering, the memory will be memory is lost, patient goes to the depression state, and patient cannot determine and cannot solve the problems and cannot judge properly. Okay, then come to the frostbite. When the patient exposed to the subnormal temperature below the normal, that condition is known as frostbite. Here in the subnormal temperature, we know that temperature remains between the 95 and 98 degree Fahrenheit or between 35 and 36 point centigrade. That is subnormal temperature. So when the condition occurs to subnormal temperature, that is known as frostbite. Frostbite when frostbite will occur when the ice crystals are formed inside the cell, that is known as frostbite. And in the vulnerable area where the frostbite occurs, that is like the tip of nose, finger, toes, that after the area becomes white, and after the area will be appear as white, and this area becomes non-sensitive. When you will touch, the patient cannot able to know about that in which area there is injury. uh, Patient cannot know about that the affected area becomes the injury or not. If the affected area becomes injured or if you touch the affected area, the patient cannot be detected or cannot be known that as your touch or injury is there. Then management of hypothermia. So always if the patient in the cold environment, remove the patient from the cold environment and provide the warm environment, like the provide the hot that is the room temperature is the above than normal. Okay, and provide the good room temperature. In the old room temperature, we keep the patient. And if the patient is in the cold environment and there is the temperature is low than the normal environment temperature, so patient remove the patient and keep the warm environment, and provide the warm blanket, and neat and clean dry clothes should be covered to the patient. And if the normally we are limbs are the separate during the sitting or during the sleeping, limbs are uh, separate from the other limbs. So at the time of the hypothermia, all the limbs will be closed, So one leg is over the another leg, and the of the same persons, and the limbs and the hands will be kept, uh, two hands will be togetherly kept, and leg should be togetherly kept, that will be also legs will be flexed, and the hands. So ହାତ ଗୋଡ଼ ସବୁ କ'ଣ ହେବ ନା ସେ ଲିମ୍ସ ଗୁଡ଼ାକ ଯେଉଁ ଲିମ୍ସ ହାତ ଗୋଡ଼ ସବୁ କ'ଣ କରିବ ନା ପୁରା ଟ୍ୱିଷ୍ଟେଡ଼ ହେଇକି ବା ହାତ ପରେ ହାତ ରଖିବ, ଗୋଡ଼ ପରେ ଗୋଡ଼ ରଖିବ, ତ ଲିମ୍ସ ଗୁଡ଼ାକ ସବୁ କ୍ଲୋଜ୍ ଟୁଗେଦର କଲେ କ'ଣ ହେବ ନା ଟେମ୍ପରେଚର ଯେଉଁ ରିଡକ୍ସନ୍ ହେଇଛି ସେଇଟା ଜଣାପଡ଼ିବନି ଏବଂ ସେ ବଡ଼ିକୁ ୱାର୍ମ ପ୍ରୋଭାଇଡ଼ କରିବ। Apply warming pads, hot water bags, and so these are the management of hypothermia. Then come to the sensory of unconsciousness. When you know that patient is conscious stage, when patient is awareness about the surrounding, and he know about that whatever the events will occur in the surrounding, so that is known as conscious. So consciousness is maintained by the impulses mediated via gray matter in the reticular activating system. ଯେତେବେଳେ ପର୍ଯ୍ୟନ୍ତ ଇମ୍ପଲ୍ସ ଗୁଡ଼ାକ ଗ୍ରେ ମ୍ୟାଟର ଦ୍ୱାରା ରେଟିକୁଲାର ଆକ୍ଟିଭିଟି ସିଷ୍ଟମରେ ପାସ୍ କରୁଛନ୍ତି, ସେତେବେଳେ ପର୍ଯ୍ୟନ୍ତ ବ୍ୟକ୍ତି କନସିୟସ୍ ଷ୍ଟେଜରେ ଅଛି ବୋଲି କୁହାଯାଇଥାଏ। ଓକେ, ଯେତେବେଳେ ବ୍ୟକ୍ତି ସ୍ଲିପ୍ରେ ରହୁଛି ସେତେବେଳେ କ'ଣ ହୁଏ ନା ଇମ୍ପଲ୍ସ ଗୁଡ଼ାକ ରେଟିକୁଲାର ଆକ୍ଟିଭିଟି ସିଷ୍ଟମରେ ଭଲ ଭାବରେ ପାସ୍ କରିପାରନ୍ତାନି, ସେଥିପାଇଁ ବ୍ୟକ୍ତି ସ୍ଲିପ୍ କଣ୍ଡିସନରେ ଥାଏ। ଓକେ, so that unconscious. So unconsciousness, but unconscious stage is different from the normal sleep. Okay, so unconscious is different from the normal sleep because in the sleeping stage patient is arousable from sleep, patient will wake from the sleep. ବ୍ୟକ୍ତି କ'ଣ ହେବ ସ୍ଲିପ୍ ଥିଲେ ମଧ୍ୟ ଯେତେବେଳେ କୌଣସି ଜିନିଷ ଇଭେଣ୍ଟ ବାହାରେ ଘଟୁଥାଏ ସେ ହଠାତ୍ କିନା ଜାଣିପାରିଥାଏ, ଉଠି ବି ଯାଇଥାଏ ସ୍ଲିପ୍ରୁ ତାର ନିଦ ଭାଙ୍ଗି ଯାଇଥାଏ ଏବଂ ସେ ମଧ୍ୟ ସରାଉଣ୍ଡିଂ ମଧ୍ୟ ଚାହିଁଥାଏ, ସରାଉଣ୍ଡିଂକୁ ମଧ୍ୟ ସେ ଡିଟେକ୍ଟେବୁଲ୍ କରିପାରିଥାଏ। So but in unconscious stage patient is not arousable and quite often. So some reflexes are the losses. There are reflexes like the he cannot maintain the free airway, he cannot breathe if he, because the free airway will be maintained by the conscious patient always through the by deep breathing, through by the taking food, swallowing food, but here the cannot maintain the free airway because sometimes mucus will be accumulated due to the he is not in the conscious stage. ବେଳେ ଫ୍ରି ଏୟାର କାହିଁ ମେଣ୍ଟେନ୍ କରିପାରୁନି, ନର୍ମାଲି ଆମେ ତ ଫ୍ରି ଏୟାରୱେ ବା ଏୟାରୱେ କ୍ଲିୟରାନ୍ସ କେମିତି ରହୁଛି ବା ଏୟାର ଯିବା ଆସିବା କେମିତି ରହୁଛି ନା ଆମେ ବେଳେବେଳେ ଡିପ୍ ବ୍ରିଥିଂ କରିଥାଉ, ବେଳେବେଳେ ଡିପ୍ ବ୍ରିଥିଂ କରିଥାଉ, ବ୍ରିଥିଂ ଏକ୍ସରସାଇଜ୍ କରିଥାଉ, ଏକ୍ସରସାଇଜ୍ କରିଥାଉ, ଫୁଡ୍ ନେଇଥାଉ, ତ ବିଭିନ୍ନ ପ୍ରକାର ୱେରେ କ'ଣ ହେବ ଆମର ଏୟାର କ୍ଲିୟରାନ୍ସ ରେସ୍ପିରେଟରୀ ଏୟାର କ୍ଲିୟର ହୋଇଯାଏ ଏବଂ ବେଳେବେଳେ ଯଦି ବି ଇଲ୍ରେ ଥାଉ ତ ମେଡ଼ିକେସନ୍ ନେଇଥାଉ। ଓକେ, ୱାଟର ମଧ୍ୟ ଫ୍ଲୁଇଡ଼ ମଧ୍ୟ ଆମେ ନେଇଥାଉ, ଫ୍ଲୁଇଡ଼ ଡ୍ରିଙ୍କସ୍ କରୁ, ଏପଟେ ଫୁଡ଼୍ ମଧ୍ୟ ଖାଇଥାଉ, ଏକ୍ସରସାଇଜ୍ କରିଥାଉ। ଓକେ, ସ୍ପିଚ୍ ମଧ୍ୟ ଦେଇଥାଉ, ତ ବିଭିନ୍ନ ପ୍ରକାର ୱେରେ ଏୟାରୱେ ଆମର କ୍ଲିୟରାନ୍ସ ହେଇ ରହୁଛି, ତ ଫ୍ରି ଏୟାରୱେ ମେଣ୍ଟେନ୍ ହେଉଛି। ତ ବ୍ୟକ୍ତି ଯେତେବେଳେ ଅନକନ୍ସିୟସ୍ ରହୁଛି ତ ସେ ଫ୍ରି ଏୟାରୱେ ମେଣ୍ଟେନାନ୍ସ କରିପାରେ ନାହିଁ, ଆଣ୍ଡ ସ୍ୱାଲୋଇଂ ମଧ୍ୟ କରିପାରେ ନାହିଁ କି କଫିଂ ମଧ୍ୟ କରିପାରେ ନାହିଁ। ଓକେ, coughing is that forcefully expelled air from the lungs, and when the harmful stimuli attack to the body, the conscious patient will be avoided, but unconscious patient cannot avoid it because he is conscious, he is unknown about that, so he becomes withdrawn from the noxious stimuli. So according to definition, the unconscious implies that The unconscious of a person is said to that when the person is cannot detected or respond to the other stimuli. A person's conscious state will be impaired, and unconscious state may be partial, that is semi coma, it is known as semi coma, or it is completely unconscious known as coma. So causes of the unconscious. So why patient becomes unconsciousness? There some certain causes there. First is see that shock condition. In the shock condition, blood pressure will be fall because due to there is a severe loss of blood. And patient goes to the burn, allergic reaction, sudden emotional distress conditions. Here we see that there is a skin becomes very cold and pale color. There is irregular breathing. Breathing is not done properly. There is a pulse rate is very pulse rate becomes very fast and people becomes dilated. That condition known as shock. In the shock condition, blood pressure कमी जाए ଏବଂ କେତେକ କଣ୍ଡିସନରେ ବ୍ଲଡ଼ ପ୍ରେସର କମିଯାଏ ଯେତେବେଳେ ବ୍ୟକ୍ତିଙ୍କର କିଛି ସିଭିୟର ବ୍ଲଡ଼ ଲସ୍ ହେଉଛି କିମ୍ବା ପେସେଣ୍ଟ ବର୍ନ ଅଛି, ପେସେଣ୍ଟ କୌଣସି ଫାୟାର ସହିତ ଆଟାଚ୍ ହେଇଗଲା ତ ତା ବଡ଼ିରେ ଫୁଟକା ତା ବଡ଼ିରେ କ'ଣ ହେଉଛି ନା ଯେକୌଣସି ଫାୟାର ସହିତ ଆଟାଚ୍ ହେଇଗଲା, ନିଆଁ ସହିତ ଆଟାଚ୍ ହେଲା ତ ସେତେବେଳେ ସେ ବଡ଼ି ପୋଡ଼ା ଜଳ କ୍ରିଏଟ୍ ହେଉଛି ଏବଂ ସବୁଆଡ଼େ ଫୋଟକା ଟାଇପ୍ ଭେସଲ୍ସ ଟାଇପ୍ର ଆମେ ଦେଖିଥାଉ ୱାନ୍ କଣ୍ଡିସନରେ। ତ କିଛି ଆଲର୍ଜିକ୍ ରିଆକ୍ସନ୍ ଯୋଗୁଁ ହେଉ କିମ୍ବା କିଛି ଇମୋସନାଲ୍ ଷ୍ଟ୍ରେସ୍ କଣ୍ଡିସନ୍ ହେଲେ ବ୍ୟକ୍ତି ସକ୍ କଣ୍ଡିସନ୍କୁ ଯାଇଥାଏ। ଏଥିରେ ସକ୍ କଣ୍ଡିସନ୍ରେ ବ୍ଲଡ଼ ପ୍ରେସର କମିଯାଇଥାଏ ଏବଂ ବ୍ୟକ୍ତିର ସ୍କିନ୍ କୋଲ୍ଡ ଆଣ୍ଡ ପେଲ୍ କଲର୍ ଦେଖାଯାଏ, ବ୍ରିଦିଂ ଠିକ୍ରେ ହୁଏ ନାହିଁ, ଇରେଗୁଲାର ବ୍ରିଦିଂ ହୋଇଥାଏ, ପଲ୍ସ ମଧ୍ୟ ଅଧିକା ହୋଇଯାଏ ଏବଂ ପିପୁଲ୍ ଡାଇଲେଟେଡ୍ ହୋଇଯାଏ। ଓକେ, ଦେନ୍ ଆସ୍ପେସିଆ conditions also develop unconscious. In the asphyxia conditions, due to certain causes, oxygen levels will be less in the body. Body cannot maintain the proper oxygens and proper oxygens normal oxygens cannot maintain in the tissue. So insufficient oxygens goes to the body. And the thrombosis conditions also develop the unconscious thrombosis like that is cerebral catastrophes, that is a hemorrhage, the severe loss of blood, and thrombosis, that is a blood clot formed in the blood vessels. Then the epilepsy condition also develop the unconscious stage, that is in the epilepsy condition people with epilepsy that is epilepsy known as that is a recurrent seizure. When epilepsy or seizure occurs, when there has a distribution of the electrical activity of brain and the disturbances in the messaging system between brain cell ମଧ୍ୟରେ କିଛି ମେସେଜ ଯିବା ଆସିବା କରିବ ନାହିଁ, ଇଲେକ୍ଟ୍ରିକାଲ ଆକ୍ଟିଭିଟି ବ୍ରେନ୍ର ଡିଷ୍ଟ୍ରିବ୍ୟୁସନ୍ ହେବ ବା ଡିଷ୍ଟର୍ବାନ୍ସ ହେବ ଏବଂ ଦେୟାର ହାଜ୍ ଅନକଣ୍ଟ୍ରୋଲ୍ଡ ଡିସଚାର୍ଜ ଅଫ୍ ଇଲେକ୍ଟ୍ରିକାଲ ନ୍ୟୁରନ୍। ଅନକଣ୍ଟ୍ରୋଲ୍ଡ ଡିସଚାର୍ଜ ଅଫ୍ ଦ ଇଲେକ୍ଟ୍ରିକାଲ ନ୍ୟୁରନ୍ ଅକର୍ସ। ଇଲେକ୍ଟ୍ରିକାଲ ନ୍ୟୁରନ୍ ଯେଉଁ ସବୁ ଅଛନ୍ତି ତାର କ'ଣ ହେବ, ନର୍ମାଲରୁ ଅଧିକା ସେମାନେ ରିଲିଜ୍ ହେବେ। ତ ସେଇ କଣ୍ଡିସନକୁ ଏପିଲେପ୍ସି ବା ସିଜର କହନ୍ତି। ସେତେବେଳେ ବହୁତ ସାଇନ୍ ସିମ୍ପଟମ୍ ମଧ୍ୟ ଦେଖାଯାଏ, ଯଥା ବ୍ୟକ୍ତି କ'ଣ କରେ, ତାର ବ୍ୟକ୍ତିର ମସଲ ସବୁ ଟୁଇଜିଂ ହେଇଯାଏ, ସେ ଫିଷ୍ଟ କରେ, ତାର ଯଦି ଆମେ ହ୍ୟାଣ୍ଡକୁ କଥା ବିଚାରକୁ ନେବା ତାହେଲେ ହାତ ସେ ପୁରା ଏମିତି ଫିଷ୍ଟ କରେ ଯେ ସେମିତି ମୁଠେଇକି ରଖେ ନିଜର ପାପୁଲିକୁ, ତ ତାକୁ ସହଜରେ ସେ ପାପୁଲିର ମୁଠାଟାକୁ ଖୋଲି ହୁଏ ନାହିଁ ଏବଂ ତାର ପାଟିରୁ ସାଲାଇଭା ସିକ୍ରେସନ୍ ହୋଇଥାଏ ଏବଂ ପାଟିରୁ ଲାଳ ବୋହିଯାଏ ଏବଂ the eye will be greatly opened eye and he becomes trembling at that time. So different type of sign symptom appears during the seizure epilepsy case, जोटाकि आम ओडिया बात मारुଛୁ ବୋଲି କହିଥାଉ ଛୋଟ ଛୁଆଙ୍କୁ, ତାକୁ ଏପିଲେପ୍ସି ସିଜର କହନ୍ତି। ତ ହାତ ଗୋଡ଼ ପୁରା ମୁଠେଇକି ରଖେ ଏବଂ ସେଇଟା ହାତ ଗୋଡ଼ ସବୁ ବଙ୍କା ହେଇଯାଏ ଧୀରେ ଧୀରେ ଏବଂ ପାଟିରୁ ଲାଳ ବାହାରେ ଏବଂ ଆଖି in the open eye will be opened, not will be not will be fault से पूरा ओपन आईरे रुहे तो आखि को केबे भी आखिर आईलास को तल को निये नहीं होला ओके जमीक आम ओडिया कही था कि से आखि तरा टी चाहिला एवं आखि ओपन करके रहा और आखि के से आखिर आईलासेस को आम साधारणतः कौन होता ना रिफ्लेक्सेस एक्शन द्वारा आम आई क्लोज करी था तो आई क्लोज करे ना टोटाल आई ओपन करके रखी था बेले बेले तो आपको एपिलेप्सी कंडीशन मत कही था देन हेड इंजुरी होता है हेड इंजुरी द्वारा हुए नेक्स्ट हाइपोथर्मिया बा हाइपरथर्मिया जो होता है एंड द रेनल फेल्योर कंडीशन आल्सो डेवलप द अनकॉन्शियस टू द पेशेंट इन द रेनल फेल्योर किडनी डज नॉट वर्क प्रॉपर्ली एंड किडनी डज नॉट फिल्टर द the kidney does not get enough blood to filter okay then infantile convulsion that is already said that in the epilepsy conditions infantile convulsion that is the muscle in the arm and legs becomes stiff and bend baby's head forward loss of skill of the baby that is sitting crawling so convulsion जोटा आम एपिलेप्सी स्टेज रे कहूली जो जब छोट छुआ को कन्वल्सन हुए तो से कौन हुए ना आर्म हाथ आर्म लेग्स मसल गुड़ा हाथ गोड़ मसल गुड़ाक सब स्टिफ हो जाए दैट इज बेंड हो जाए एंड बेबीज हेड फॉरवर्ड बेंड हो जाए एंड पर्सन्स विल बी समटाइम्स रिमेन्स ओपन आई डज नॉट क्लोज देयर आई ओके एंड लॉस ऑफ स्किल ऑफ द बेबी लाइक द सिटिंग क्राउलिंग एसेट्रा से बस पारे ना कि गुरुंडी पारे ना ओके then heat stroke also develop the consciousness overheating of the body or body exposed to the excess heat or high temperature when temperature raises above than 104 degree Fahrenheit or 40 degree Celsius that condition known as the heat stroke okay next the apoplexy it apoplexy also a stroke like symptom occurs because due to the bleeding here blood clot will form in the brain that कौन है ना ब्रेन ब्लड क्लॉट फॉर्मेशन हुए एवं स्ट्रोक सिम्पटम्स मध्य देखा जाए ताकू आपोप्लेक्सी कहती आपोप्लेक्सी जो व्यक्ति अनकॉन्शियस स्टेज को चली जाए देन द डायबिटीज मेलिटस आल्सो अनदर कॉजेस to develop the unconsciousness in the diabetes mellitus there is increase the blood sugar levels or glucose levels in the body cannot use the glucose but diabetes mellitus कौन हुए ना blood glucose level टा बढ़ी जाए blood रे कहीं ना बॉडी ग्लूकोज को ठीक भाव में यूज कर पारे ना ओके through by the Glasgow scales we assessment the unconsciousness we assessment the conscious level of the unconscious patient through by the Glasgow coma scale हम से Glasgow coma scale माध्यम रे पेशेंट रो कॉन्शियस लेवल को जानी था ओके सो ग्लासकोमा स्केल इज ए टूल फॉर असेसिंग पेशेंट्स रेस्पॉन्स टू स्टिमुली तो पेशेंट स्टिमुली प्रति केते रेस्पॉन्स करूचे ताकू जानिबा पई हेले आमे ग्लासगो कोमा स्केल यूज करि थाउ ओके इट इज वेरी इंपोर्टेंट फॉर द टॉपिक ओके तो ग्लासगो कोमा स्केल कौन ना ग्लासगो कोमा स्केल मध्य वी आसेस द कॉन्शियस लेवल ऑफ द अनकॉन्शियस पेशेंट अनकॉन्शियस कॉन्शियस लेवल केते अछि ताकू जानि होता है हाउ it also assess the patient's response to stimuli patient stimuli को outside stimuli को केते response करूची ताकू जाने पई हम ग्लासगो कोमा स्केल यूज करि थाउ in the Glasgow coma scale there is three types of response are observed that is eye opening verbal motor एथरे ग्लासगो कोमा स्केल रे तीन टाइप रे रेस्पॉन्स रही गोटे आई ओपनिंग गोटे भर्बाल गोटे मोटर आई ओपनिंग तो आई ओपनिंग की आई ओपनिंग रे से आम जदि किसी भर्बाल किसी कहवा कि तार आई स्पॉन्टेनियस ओपनिंग ही रोचे सब बेले कि पेनफुल स्टिमुली देले आई ओपनिंग होची तो ये अनुसार आम आई ओपनिंग रे आम तार स्कोर डिटरमाइन करवा तो ग्लासगो कोमा स्केल तार कॉन्शियस लेवल केते अछि जानि होता है देन भर्बाल किछि आम कहवा द्वारा जदि ବା ସେ କିଛି ଆମର କ୍ୱେଶ୍ଚିନ୍ ଆନ୍ସର୍ ଯଦି ଦେଲା ତାହେଲେ ସେ ଭର୍ବାଲ୍ରେ ତା'ର ମଧ୍ୟ କିଛି ରେସ୍ପନ୍ସ ରହୁଛି, ରେସ୍ପନ୍ସ ରହିଲା ତ କିଛି ସ୍କୋର୍ ସେ ମଧ୍ୟ ତାକୁ ଆମେ ସ୍କୋରିଂ ସିଷ୍ଟମ୍ ଦ୍ୱାରା ଆମେ କନସିୟସ୍ ଲେବୁଲ୍ଟାକୁ ଜାଣିଥାଉ। ମୋଟର ସିଷ୍ଟମ୍ ଦ୍ୱାରା କ'ଣ ହୁଏ ନା ତା'ର ଯଦି କିଛି ଆର୍ମ ବା ଲେଗ୍ କିଛି ରେସ୍ପନ୍ସ କଲା ଆମେ କିଛି କ୍ୱେଶ୍ଚିନ୍ ଆନ୍ସର୍ ଦେବା ପାଇଁ ତ ସେଇ ସମୟରେ ଆମେ ଜାଣିଲେ ଯେ ତା'ର ମୋଟର ରେସ୍ପନ୍ସ କିଛି ରହୁଛି ତ ସେଇଠୁ ଜାଣିବା ତା କନସିୟସ୍ ଲେବୁଲ୍ ତା'ର କେତେ ରହିଛି। ଓକେ, so Glasgow scales will mainly 3 types of response are observed। 3 type of response observe करा जाए Glasgow scale रे। So see that the Glasgow scale, first is the category and response, then the score। So in the Glasgow scale, total highest score is the 15। okay, it is the best score, and best score is the 15, it is the highest score also, and where the patient is the response to stimuli and patients also remains in the conscious level। when the score below than 3, the patient goes to the deep coma stage and patient certain times goes to the death। यदि Glasgow scale रे response 3 रु कमी जाए ताले व्यक्ति कोमा स्टेज डीप कोमा स्टेज को चली जाए एवं डेथ कंडीशन मध्य चली जाए। व्यक्तिर जिते Glasgow स्केल रेस्पन्सटा बा स्कोरिंगटा 3 to 6 रहे से व्यक्ति कोमा स्टेज को चली जाए। ओके, so in the Glasgow scales, first see that that is the first response is the eye opening। when the we see that person the patient is always continuously or spontaneously opened their eye, so we score the point we point the score 4। okay, when the we ask the patient we ask the patient like the where are you come from, what is your name, if patient give the response give answer that is my name is Ramesh, Rakesh, or etc, and he explain their name and also tell that where you come from and what is the date today, if patient's response after the verbal request, then we score the 3 points। and here the also through by the verbal request the patient open their eye and then you score the 3। when we give the painful stimuli, that is the we press the we pressing the patient's fingertips and patient open their eye and gives the response, then we score the 2 points। if there is a no opening their eye after the painful giving the painful stimuli, then we score the 1 point। so eye opening रे कौन हुए ना व्यक्ति यदि continuous in the eye opening the maximum score is the 4 and minimum score is the 1। eye opening केस रे तले व्यक्ति कौन होची ना continuous तार आई ओपनिंग कर रखुची ताको आम स्कोर 4 दे थाउ। एंड जिते व्यक्ति को किसी क्वेश्चन पचारू तार आंसर मिल जाए एवं से रेस्पॉन्ड करे एवं आई से आई ओपनिंग करके रेस्पॉन्ड करे तो से स्कोर 3 दे थाउ। जिते गोटे पेनफुल स्टिमुली दे थाउ से व्यक्ति रेस्पॉन्ड करे ताको आम स्कोर 2 दे थाउ स्कोर 2 रही था। जिते किसी पेनफुल स्टिमुली देला से आई ओपनिंग कला ना ताले स्कोर 1 दे थाउ। ओके, चले ये आई ओपनिंग रे फास्ट जदि स्पॉन्टेन व्हेन द व्हेन पेशेंट इज कंटिन्यूअसली ओपनिंग देयर आई, दैट इज वी गिव द स्कोर 4। ओके, so if the patient is not opening their eye, then we go to the next stage like the open to give the verbal request, we ask them questions, if the patient give response, then we give the score 3 points। if the patient is not respond to the verbal request, then goes to next stage, that is the give the painful stimuli to open the eye। if the through by the painful stimuli like the give pressure to the fingertips and if patient respond, then give score the 2 points। and if we squeeze the muscle of the trapezius muscles, then it is a painful stimuli, after that patient open their eye and then we give the 2 points. If the patient is not no opening their eye after painful stimuli, then we score the 1 point. তাহলে যেତେବେଳେ ব্যক্তি କ'ଣ କରୁଛି ନା ଏଇଟା ସାଧାରଣତଃ ହେଡ଼୍ ଇଞ୍ଜୁରି କେସ୍ରେ ଦେଖାଯାଏ ବେଶୀ ତ ବେଶୀ ହେଡ଼୍ ଇଞ୍ଜୁରି କେସ୍ରେ ଅନକନ୍ସିୟସ୍ ଷ୍ଟେଜ୍କୁ ଚାଲି ଯାଇଥାଏ ତ ସେତେବେଳେ ଆମେ ଗ୍ଲାସ୍ କୋମା ସ୍କେଲ୍ ଉପରେ କନସିୟସ୍ ଲେଭେଲ୍କୁ ଜାଣିଥାଉ ତ ସ୍କୋରିଂ ମାଧ୍ୟମରେ ମ୍ୟାକ୍ସିମମ୍ ସ୍କୋର ହେଲା 15 ଆଣ୍ଡ ମିନିମମ୍ ସ୍କୋର ବିଲୋ ଦ୍ୟାନ୍ ରିମେନ୍ସ ବିଲୋ ଦ୍ୟାନ୍ 3 ପେସେଣ୍ଟ ଗୋସ୍ ଟୁ ଡିପ୍ କୋମା ଆଣ୍ଡ ଡେଥ୍ ଯଦି 3 ରୁ କମି ଯାଉଛି ତାହେଲେ ପେସେଣ୍ଟ ଡିପ୍ କୋମା ବା ଡେଥ୍ ଅବସ୍ଥାକୁ ଚାଲି ଯାଉଛି ତାହେଲେ ଆଇ ଓପନିଂ କେସ୍ରେ ଫାଷ୍ଟ ଯଦି ବ୍ୟକ୍ତି ପେସେଣ୍ଟ ଯଦି କଣ୍ଟିନ୍ୟୁଅସଲି ଆଇ ଓପନ୍ କରି ରହୁଛି ତାହେଲେ ଆମେ ୱି ଆସେସ୍ ଦ ବିହେଭିଅର୍ ଆଣ୍ଡ ୱି ପଏଣ୍ଟ ଦ ସ୍କୋର 4 points. तो स्पॉन्टेनियस ओपनिंग रे जदि आई ऊपर रखि ताले 4 दउची जदि स्पॉन्टेनियस ओपनिंग करू नै ताले हम नेक्स्ट स्टेज को जिवा किछि क्वेश्चन पचे वर्बल रिक्वेस्ट करबा जदि आई ओपनिंग करछि ताले 3 पॉइंट दबा तापर जदि से रेस्पोंड कला नै ताले पेनफुल स्टिमुल दबा जथा कोन फिंगर टिप ऊपर प्रेशर दबा बा टापिजम स्क्वीज करबा ताले ताको से 2 दबा जदि से रेस्पोंड कला जदि पेनफुल स्टिमुल रेस्पोंड कला नै आई ओपनिंग कला नै ताले ताको हमें स्कोर 1 दबा. Then come to the verbal response. In the verbal response, when you see that patient is worried to time, place, etc., and give conversation appropriately, we ask the questions we ask the patient like the what is the date today, and mention your family members. If patients responds properly and give questions answer and respond to your asking questions verbal questions, then you give the you score the point 5. Here we assess the complete behavior of the patient. ଯେତେବେଳେ verbal response କ'ଣ ହେଉଛି ନା patient ଯେତେବେଳେ ତାର ଆଜି which is the ଯେତେବେଳେ verbal response ରେ patient କ'ଣ କରୁଛି ନା ଫାଷ୍ଟ ତାକୁ assess କେମିତି କରିବା ନା ଯେତେବେଳେ patient ଟାଇମ୍ ପ୍ଲେସ୍ ସହିତ ଓରିଏଣ୍ଟେସନ୍ ରହୁଛି ଆଜି କେତେଟା ସମୟ ହେଇଛି ତୁମେ କେଉଁଠାରୁ ଆସିଛ ଆଜି ଡେଟ୍ କେତେ ସେ ପ୍ରପରଲି କହିପାରୁଛି ବା କନଭରସେସନ୍ କରିପାରୁଛି ଏବଂ ଏଥିରେ ଆମେ ତାର କମ୍ପ୍ଲିଟ୍ ବିହେଭିଅର ମଧ୍ୟ କମ୍ପ୍ଲିଟ୍ ବିହେଭିଅରକୁ ଆସେସ୍ କରିପାରିଲେ ଏବଂ ତାର ରେସ୍ପନ୍ସ କେତେ ଦେଲା ସେଇଟା ଜାଣିପାରିଲେ ତ ସେତେବେଳେ ଆମେ ସ୍କୋର ଦେଲେ କେତେ 5. ଓକେ. Patients give proper answer about the questions but confused. ସଡନ୍ କ'ଣ ହେଉଛି ନା ପେସେଣ୍ଟ ସବୁ ରିପ୍ଲାଏ ଦେଉଛି ବଟ୍ କନଫ୍ୟୁଜ୍ଡ ରହୁଛି ବେଳେବେଳେ କନଫ୍ୟୁଜ୍ ରହୁଛି. when you ask the questions like what is the day today, then he asked the 23 date, 24 date, 23 February, but certain times again will say that sorry it is now the 24th February or 26th February. तो साधारणतः କ'ଣ ହେଉଛି କନଭର୍ସ ଠିକ୍ ରହୁଛି ବଟ୍ କନଫ୍ୟୁଜ୍ଡ ରହୁଛି ତ ସେ କେଉଁଠାରେ ଆସିଛି ଯେତେବେଳେ ତାକୁ ଆଜି ଡେଟ୍ କେତେ ପଚରାଉଛି ସେ କେତେବେଳେ 22 କହୁଛି ପୁଣି 24 କହୁଛି ତ ସେଇ ଡେଟ୍ଟାକୁ ଡିଫରେଣ୍ଟ ଟାଇପ୍ରେ କହୁଛି କନଫ୍ୟୁଜ୍ ହେଇଯାଉଛି ଏବଂ କେଉଁଠାରେ ଆସି ଯଦି ହୋୟାର କମ୍ ଫ୍ରମ୍ ପଚାରୁଛେ ସେ କେଉଁଠୁ ଆସିଛି ପଚାରୁଛେ ତ ସେତେବେଳେ କହୁଛି ସେ ଏଇ ଏରିଆରୁ ଆସୁଛି ପୁଣି କହୁଛି ସେଇ ଏରିଆରୁ ଆସୁଛି ତ ଡିଫରେଣ୍ଟ କନଭର୍ସ ବଟ୍ କନଫ୍ୟୁଜ୍ଡ ୱି ସ୍କୋର ଦ 4 points. Then the word spoken but conversation is not sustained. He when you ask the questions then he randomly gives their questions answer but it is not related to the appropriate question answer. ଯେତେବେଳେ କ'ଣ କହୁଛ ନା ଏକ୍ଜାମ୍ପଲ୍ when asked the questions like what is the day today, ଆଜି କି ବାର ପଚାରିଲେ ସେ କହିବ ଆଜି today is the Wednesday, again ସେ today is Thursday, Friday, today date is the 3. ତ ଯେତେବେଳେ ତୁମେ ଡେ ପଚାରୁଛ ସେତେବେଳେ ସେ ଡେଟ୍ କହୁଛି କିମ୍ବା ଆଜିର ବାର ଅନ୍ୟ ଆଡ଼େ କହୁଛି କିମ୍ବା ଆଜି କେଉଁଠାରୁ ଆସିଛି ସେ ଆନ୍ସର୍ ଦେଉଛି ତ ଏଥିରେ ଯେଉଁ କ୍ୱେଶ୍ଚିନ୍ ପଚାରିଲ ତାର ଆକ୍ଚୁଆଲି କ୍ୱେଶ୍ଚିନ୍ ସହିତ ରିଲେଟେଡ୍ ହେଲା ନାହିଁ. ଇଟ୍ ଇଜ୍ ବିକମ୍ସ କନଭରସେସନ୍ ସଷ୍ଟେନ୍ଡ. The persons when aware about the sound when you made but you do not give respond to your the spoken word. spoken word को सहित spoken word जहाँ भी कहबा से रेस्पॉन्स करिवनी किंबा साउंड कले से ताको रेस्पॉन्ड करूची तो सेतरे we give score 2 points. So when patients when patient do not aware about the sound, then that means the patient no response, we give the score 1 point. तो patient जो टाइम प्लेस सहित ओरिएंटेशन होची ठीक भाव से प्रॉपर्ली कन्फरेन्स करें कौ टाइम रे कौ डेट्रे कौ प्लेस आसपारे तेल आम 5 स्कोर देले जो पेसेंट ओरिएंट टाइम प्लेस सहित जो व्यक्ति टाइम प्लेस सहित ओरिएंटेशन हो ना ठीक कन्फरेन्स करना जो आम नेक्स्ट स्टेज को जावा ताकू किसी ताकू पुणी एगेन क्वेश्चन पचार जदि से कन्भर्स ठीक करें बट कि कन्फ्यूज रोचे से पॉइंट स्कोर पॉइंट देला 4 पॉइंट देले जो व्यक्ति कौन करुच्ची ना कहूँ बट जहाँ भी क्वेश्चन आंसर दूसरी ताहा क्वेश्चन आंसर सहित मैच करूना से आम स्कोर देले 3 पॉइंट जदि व्यक्ति कौन गला ना किसी कहूना कि क्वेश्चन आंसर ठीक भाव में देलानी कि से रियलिटी क्वेश्चन सहित न था बोलते किसी आंसर देलानी से आम किसी साउंड तैयारी कले साउंड देले तो साउंड रे किसी जब रेस्पॉन्स देला तेल आम ताको स्कोर 2 देले आउ से कहला ना जो किसी साउंड देला ताको रेस्पॉन्स कला 2 देले जदि से ना साउंड रे देले जानी पारुची कि कहले किसी रेस्पॉन्स करुच्ची तो दुईटाक से किसी रेस्पॉन्स कलानी साउंड रे रेस्पॉन्स कलानी कि किसी कहले क्वेश्चन आंसर रेस्पॉन्ड कला ना से व्यक्ति को नो रेस्पॉन्स कैटेगरी जाए रेस्पॉन्स जाए स्कोरिंग आम 1 दे था देन कम द मोटर रेस्पॉन्स इन द मोटर रेस्पॉन्स व्हेन पेशेंट्स बेंडिंग देयर रेजिस्ट देयर आर्म्स or legs or resist their limbs, then it is known as motor response. जैसे क्वेश्चन पचारुचे जदि से किसी हाथ उठे कि कहला कि किसी गोड़ हाथ हल्ले कि कहला तो लिम्स किसी आर्म्स देयर पाम रेजिस्ट बाय द रेजिस्ट द पाम बा हैंड हाथ उठे जदि किसी रेस्पॉन्ड कला ताहले आम से मोटर रेस्पॉन्स कही था ए लिम्स कौन हो एक्टिवेटेड रे व्हेन we ask to the patient and give some commands raises your hand and put your forehead जो रेज हैंड पुट फोरहेड कहूचे तो व्यक्ति कौन करे जब कमांड को ओबे कला एवं निजर हाथ नहीं कि फोरहेड रखला जो जाने इंडिविजुअल गिव्स प्रॉपर रेस्पॉन्स टू योर कमांड सो हियर वी स्कोर 6 points when you pressure the fingertips or squeeze the trapezius muscle जेतले आम trapezius muscle squeeze करूचे कि फिंगर टिप प्रेशर दौचे then the persons or individual's hand or patient's hand goes to the that area that is known that condition known as patient localized to the पेनफुल स्टिमुली वी स्कोर द 5 points जो व्यक्ति कौन आम कौन प्रेसर को जरिए दौचे धर फिंगर टिप प्रेसर दौचे कि टाप स्क्विज करते तो व्यक्ति रेस्पॉन्स कर पारा केमी ना जो तार हाथ नहीं कि से एरिया रखला ताहले आम स्कोर देले 5 points देन पेशेंट्स ट्राई टू avoid the painful stimuli and he also throughout the hand of the अदर पर्सन्स ओके जो व्यक्ति ताको पेनफुल स्टिमुली दौथिबो बा जो सोर्स पेन स्टिमुली आउथिबो सेठु से कौन करिवो से व्यक्तिर जदि कौन से व्यक्ति पेनफुल स्टिमुली दौताए ताले से व्यक्तिर हैंड को बाहर करने को चेष्टा करिवो ओके से हाथ निजे उठेकी करने को ट्राई करिवो तो सेतले हम जानले जे द पेशेंट इज अवेयर अबाउट द in which area the painful stimuli is given so we score the 5 points यदि व्यक्ति पेनफुल स्टिमुली को दिहला तो जानी पारानी रेस्पॉन्ड कला ना ताले हम नेक्स्ट स्टेज को जीवा दैट इज विड्रॉ आउट टू पेनफुल स्टिमुली पुणी एगेन पेनफुल स्टिमुली दबा द व्यक्ति जो कौन करा विड्रॉ करुच्ची पेनफुल स्टिमुली जो अवॉइड करुच्ची तार हाथ उठाऊँच चेष्टा करुच्ची जे तार हाथ उठाऊँच बट से लोकालाइज्ड एरिया को जापार ना से हाथ उठे माने मीन्स है जे से स्टिमुली को अवॉइड करने चाहूँ विड्रॉल करने चाहूँ तो ये आम स्कोर देवा 4 जदि व्यक्ति किसी पेन स्टिमुली विड्रॉल कर पारे विड्रॉल करूना तेणु नेक्स्ट मोटर रेस्पॉन्स को जीवा दैट इज नोन एज abnormal फ्लेक्शन टू पेन सो abnormal फ्लेक्शन टू पेन दैट मीन्स Abnormal flexion to a painful stimulus typically involves adduction of the arm, internal rotation of the shoulder, pronation of the forearm, wrist flexion. ଏଥିରେ କ'ଣ ହୁଏ ନା abnormal flexion ଯେତେବେଳେ painful stimulus ଦେବା ତାହେଲେ abnormal flexion ବଡ଼ିରେ ପେସେଣ୍ଟ ବଡ଼ିରେ abnormal flexion ଦେଖାଯାଇଥାଏ stimulus ପ୍ରତି। ସେଥିରେ ସେ ବ୍ୟକ୍ତି କ'ଣ କରେ ନା ଆର୍ମକୁ ଆଡକ୍ସନ୍ କରେ ଏବଂ ସୋଲ୍ଜରକୁ ରୋଟେସନ୍ କରିକି ସେ ପେନଫୁଲ୍ ଷ୍ଟିମୁଲ ଆଡ଼କୁ ହ୍ୟାଣ୍ଡକୁ ବା ଲେଗ୍କୁ ନେଇଥାଏ। wrist ମଧ୍ୟ flexion करे। okay, these are known as decorticate positioning that indicated there may be a significant damage to area including cerebral hemisphere, internal capsule and thalamus। तो एटा को आमे decorticate positioning कहिथाउ कारण एथरे stimulus पेनफुल स्टिमुलस जो रोचे से abdominal फ्लेक्शन व्यक्ति abdominal फ्लेक्शन देखा था जो पेनफुल स्टिमुल प्रति जोटी आमर पेन जो जगार क्रिएट होची जो लोकलाइज पेन क्रिएट से एरिया प्रति से abdominal फ्लेक्शन व्यक्ति करि थाए केमिति ना आइदर से जो जगार भी पेन होची से जगह ऊपर कौन सी जिनस कौन से हाथ बा आर्म किसी लेग रखे नहीं से एरिया पर जदि रखे ताको इट फील और सी फील डिफिकल्ट और फेसेस पेन excess pain so that she cannot keep arms legs over the painful area, so he take the abnormal flexion like the he keep the adduction of the arm, internal rotation of the shoulder, pronation of the forearm, wrist flexion। तो से जदि मन कर कौन सी एरिया बॉडी तो पेन इंजुरी होती तो से पेन क्रिएट होती तो व्यक्ति अनकॉन्शियस स्टेज रे थिले मध्य भी से कौन करुचे जदि तार रिस्ट को फ्लेक्स करके रखिथिबो किंबा हाथ को फ्लेक्शन करके रखिथिबो ओके दैट इज नोन द एडक्शन ऑफ द आर्म किंबा शोल्डर को हेड रो ऊपर को देके सोइथिबो ओके बा रिस्ट को फ्लेक्शन करके सोइथिबो ताले एड सब abdominal फ्लेक्शन कहंती ओके तो एको कहंती डेकोरेटिकेटेड पोजिशन ही कहंती because due to the damage in the hair cerebral hemisphere, internal capsule and thalamus। तो ब्रेन रे जेकोसी एरिया जदि कौन सी डैमेज होइछि सेरेब्रल हेमिस्फीयर डैमेज होइछि किंबा इंटरनल कैप्सूल डैमेज तो व्यक्ति abdominal फ्लेक्शन टू पेन को abdominal फ्लेक्शन सु देखाई थाए जेहेतु ताको पेन होउछि तो से abdominal फ्लेक्शन देखाई थाए जथा इंटरनल रोटेशन करि थाए शोल्डर को किंबा एडक्शन ऑफ आर्म को एडक्शन करके रखि थाए से फ्लेक्शन करके आर्म को रखि थाए किंबा रोटेशन शोल्डर को रोटेशन करके रखि थाए। then go to the abdominal extension to pain, here it is also a decriminated positioning okay, here the head is extended with the arm legs, here the head is extended then the arm legs also extended, internal rotation also occur। इधर कहाँ बना हेड एक्सटेंड होकर रही थाए आर्म लेग मध्य एक्सटेंड होकर रही थाए ओके यदि शोल्डर मध्य इंटरनल रोटेशन होकर रही थाए ए पोजीशन रे। so a decorated patient gives a decorated positioning in the abdominal। so व्यक्ति कौन करे ना पेनफुल पेन प्रति से कौन करे ना abdominal extension बॉडी पोजिशन को रखी थाए। abdominal extension कौन कहते ना it is known as decorticate positioning। तो abdominal extension को कहते decorticate positioning कही थाउ ऐसे डेकोरेटिव पोजिशन कौन व्यक्ति कौन हुए ना ता हेड को एक्सटेंड कर रखे आर्म लेग को एक्सटेंड कर रखी था कारण जना पड़ा जे व्यक्तिर कौन जगह पेन होची साधारणतः ब्रेन इंजुरी केस देखा जाए सेरेब्रल हेमिस्फीयर डैमेज जो तो ये व्यक्ति डेकोरेटिव पोजिशनिंग करे तार abnormal एक्सटेंड बॉडी विभिन्न पार्ट को abnormal एक्सटेंशन रखी था जथा हेड को एक्सटेंड कर रखे आर्म लेग को एक्सटेंड कर रखे। हेयर पेशेंट अपेयर रिजिड विथ द टीथ क्लिंट ये पेशेंट रिजिड देखा जाए एवं टीथ को क्लिंच करके रखे सब दांत टीथ पूरा टाइटली से फिक्स कर रखी थाए। द साइंस कैन बी इन जस्ट वन साइड ऑफ द साइन कैन सीन इन द जस्ट वन साइड ऑफ द बॉडी और बोथ साइड ऑफ द बॉडी ओके। Here best score is 15, row score is 3, conscious stage when you call the conscious patient is conscious when the score is 13 to 15, when the patient score is 9 to 12 semi conscious, when the patient is when the score is 6 to 9 patient is known as unconscious stage, when the patient when the score of the Glasgow scale is about the 3 to 6 the patient is going to coma stage, when the scores remains below the 3 that the patient goes to the deep coma stage. Then on the management of the unconscious patient. So here nurse should understand what is factor affect to patient by which unable to carry their daily activities. तो नर्स से जानले जे कौन से फैक्टर सब पेशेंट ऊपर अफेक्ट पकई जेहेतु पेशेंट अनकॉन्शियस स्टेज रे अछि एवं से तार डेली एक्टिविटी ठीक रहे नहीं पारु नहीं तो ये विषय नर्स भल भाव बुझा उचित देन नर्स शुड गिवन केयर इन 2 फेजेस तार नर्स कौन करिवो दुईटा फेज रे केयर दबो फर्स्ट इज इमरजेंसी केयर और फर्स्ट एड देन द लॉन्ग टर्म केयर so first that emergency care so in the emergency care has certain general rules okay if the casualty or the patient remains in the hazardous condition then remove the casualty from that conditions and asking for the help. So if the example is the in the road accident there is a severe hemorrhage of the brain then suddenly remove the casualty and ask the help and send the hospitals and always be give careful conscious at that time that injury to spine there has a injury to the spine or the injury in the spine is present not it will be observed by the nurses. हॉस्पिटल केस जदि कौन सी कंडीशन जदि व्यक्तिर व्यक्ति हार्ट अटैक कंडीशन रहा तो साधारणतः आम कौन सी रिस्क सिचुएशन रहा तो हार्ट बीट कमीगला कि रेस्पिरेशन कमीगला तो से कौन करें आम कौन सी हेल्थ मेम्बर को डाकी था साहय करने सब बी केयरफुल अबाउट द इंजुरी टू द स्पाइनल कॉर्ड इंजुरी हो ना सब जानवे ट्राए करवा कारण स्पाइनल कॉर्ड जो इंजुरी हो जाए तो व्यक्ति इम्बालांस कंडीशन आसी जाए ये सेंसेशन ठीक रे जी पेसेंट अलर्ट रोला से अलर्ट रही पेसेंट फाटल स्टेज को जीव हरी कहीं रेस्पिरेशन रेट पल्स रेट सब कमीज इन द सेंट्रल नर्वस सिस्टम स्पाइनल कॉर्ड ब्रेन इज मेन इंपोर्टेंट रोल वी नो ओके. Then check the breathing pattern and if in obstruction of the airway it is also be observable airway किसी obstruction अच्छी कि नहीं तक मत देखिए and that because due to the blood clot or due to the dentures air will be obstructed so check the breathing always and maintain the airway clearance. If the patient do not take properly breathing to provide artificial respirations if there when we know that there is no pulse rate and pulse rate is very weak then carry out the external chest compressions provide one rescue CPR जो देखिए पल्स रेट ठीक भाव में पेसेंट हो ना पल्स ठीक भाव पल्स मेजर कर तेणु एक्सटर्नल चेस्ट कंप्रेशन पेसेंट को प्रोवाइड करवा एक्सटर्नल चेस्ट कंप्रेशन एक्सटर्नल चेस्ट कंप्रेशन देखिए पल्स रेट को आने को नॉर्मल पल्स रेट को आने चेष्टा करवा कि CPR सेरेब्रल पल्मोनरी रिससिटेशन पेसेंट को दबा कहीं पेसेंट पल्स रेट को ठीक नॉर्मल को आने ओके. Then loosen all tight clothes if both pulse and respiration present जब पल्स रेस्पिरेशन देखुचे बॉडी रे ठीक भाव में नॉर्मल रेट अच्छी तेणु आम सब क्लथ को जो टाइट क्लथ को लूज करदे जदि पेसेंट ब्लीडिंग होची ताले जेकोसी लाइफ थ्रेटनिंग कंडीशन रोचे आम भल ट्रिटमेंट दवा एग्जांपल तो ब्लीडिंग होले लाइफ थ्रेटनिंग इंजुरी से ट्रिटमेंट पेसेंट को दवा ओके. देन if available if there is we know that there is oxygen level is very low then if available then give oxygen by mask If there is a pulse is very weak, then instead of the patient, then we elevate the leg of the patient. ଯେତେବେଳେ ଦେଖିବା ଯେ pulse rate ବହୁତ କମ୍ weak ରହୁଛି, ଯଦି leg flexion ହେଇକି ଥାଏ ତାହେଲେ ଆମେ elevated ତାର leg arm limb ଗୁଡ଼ାକୁ elevate କରି ରଖିବା ଏବଂ ବ୍ୟକ୍ତିକୁ ଅକ୍ସିଜେନ୍ ଦେବା। ଏବଂ also be place the and support the patient in semi prone position. Semi prone position ରୁ patient କୁ ରଖିବା। Okay. And do not leave the patient alone. Do not administer oral fluid if the patient, because patient is unconscious subject. The oral fluid देबने काहे it will be aspiration to the lungs and by which the airway there has cannot be maintained proper airway. Keep warm the patient with warm blanket and send the patient medical if they are required. Okay. Then comes the long term care. If you provide the, if the patient is in the hospitalizations and the disease is not cured properly, the patient in the unconscious stage due to the brain injury, the patient remains in the hospital for a prolonged time period, so that we enhance our we enhance the health care in the we enhance the giving the care to the patient which is in the hospital. जो पेशेंट हॉस्पिटल रे बहुत दिन पर्यंत रोचंती ब्रेन इंजुरी होची, तो से ब्रेन इंजुरी ठीक रे भाबरे ब्रेन इंजुरी जेहेतु रिकवरी हो पारु नाही, तो पेशेंट बहुत दिन पर रोची, सेतला हमें हेल्थ केयर स्टेटस टाको बढ़ाई देबा। ओके। एवं जानिया चाहिए जे को कारणरू अनकॉन्शियस व्यक्ति रहउची, सो दैट फॉर द रीजंस वी कलेक्ट द हिस्ट्री, वी डू द एग्जामिनेशन, फिजिकल एग्जामिनेशन, इन्वेस्टिगेशन शुड बी डन। ओके। And here for that reasons to know the causes and giving care of the patient, so all the health team members like doctor, nurses, physiotherapy needs to also be involved. So so for the reasons it also require an intensive care unit, so in the patient should be remain the ICU. Okay. So certain type of treatments are provided by the nurses as well as the healthcare team members. So let's to see that. So give the positioning and passive exercise. So always when the patient is unconscious, he is the immobility stage, he cannot walk, unable to resist, unable to wake from the bed, and do not do the exercise, so that we provide the passive form range of motion to the patient by the assist with the other health team members. The patient will be walk and do the certain times of exercise also, and giving the recommended positions to the patient. It will be helpful for the improve the drainage system and improve the release of the drainage of the secretion, and it will also help the maintain patient airway. So recommended position देवा फले कौन है ना secretion body रो mucous respiratory tract जहाँ secretion तला भलो रिलीज होए एवं patient रा airway maintain ठीक रे होई पारे. Then come to the airway. To maintain the airway, always patient airway should be cleared, and always be tried to mucus should be release, and the whatever the secretion is there, that will be removed through by the drainage, free drainage. तो पेशेंट एयरवे सब क्लियर एयर को क्लियर रखा चाहिए कहीं पेशेंट से रेस्पिरेशन ठीक भाव में नवा उचित, कारण अब ध्यान देवा जे जमी ऑक्सीजन लेवल बॉडी रे कम जमी कम न हो जाए. सो सर्टन टाइम्स ऑफ इन सर्टन टाइम्स देयर इज accumulation of mucus is there in the respiratory tract, so that we try to remove the secretions or release the secretion. If required the suction through by the suctioning method, through the suctioning apparatus, the secretion will be removed. जदि कौन सी मिकोस रोचे सब चाहिए तो मिकोस को रिलीव करने रेस्पिरेटरी रू एवं सिक्रेशन को रिलीज करने चाहिए कहीं व्यक्ति ठीक भाव में निश्वास प्रश्वास नहीं पार, रेस्पिरेटरी ट्रैक्ट ठीक एयरवे पास आउट हो पार. एवं जदि बेसी सिक्रेशन रोचे तो एयरवे ऑब्स्ट्रक्शन होची ताले सक्शन apparatus नहीं कि सक्शनिंग करवा, सक्शनिंग मेथड द्वारा कहाँ मिकोस रिलीज हो जाता है. Then tooth and mouth also be assessed. If there is a denture, that should be removed. If there we also observe the any loose tooth is there, that should be removed. Okay, because it obstruct the airway. ଯଦି କିଛି ଡେଞ୍ଚର ବା ଆର୍ଟିଫିସିଆଲ ଟିଥ୍ ଲଗେଇଛି କିମ୍ବା ଲୁଜ୍ ଟୁଥ୍ ଅଛି ତାକୁ ଆମେ ବାହାର କରିନେବା, କାହିଁକି ନା ୟାର ଅବଷ୍ଟ୍ରକ୍ସନ୍ କରିଥାଏ, ଯଦି ଧ୍ୟାନ ଦେବା। ଦେନ୍ observe the input and output chart and strictly monitor the urine output. Their urine color, consistency also all are should be recorded. Then come to the hygiene. Provide the greater hygiene to the patient to giving the clean linens and mouthwash should be given to the patient. Provide bed bath as per required. Okay, clean the mouth twice a day and apply the mouthwash solutions like the potassium permanganate solutions, and apply the emollients like the Vaseline, borax, liquid paraffin. And if the eye is not if you see that eye is not proper care, so throw away the sterile saline, eye will be washed. So eye irrigation should be done in order to prevent the conjunctivitis or the eye inflammations. Also care to given to the pressure area because certain bony prominence area in the body like the below in the knee, shoulder area, that is scapulocapical area, that area will be more prone to the pressure sore. ଯେହେତୁ ବୋନି ପ୍ରମିନେନ୍ସ ଏରିଆ ବଡ଼ିରେ ଯେଉଁଟା ଅଛି, ଯେଉଁଟା ଆମର ଫୁଟ୍ର ଯଥା ଆଙ୍କେଲ୍ ଏରିଆ ହେଉ କିମ୍ବା ନି ଏରିଆ ହେଉ କିମ୍ବା ସୋଲ୍ଜର ଏରିଆ ହେଉ ଏଲ୍ବୋ ଏରିଆ ହେଉ, ତ ଏଇଟା ବୋନି ପ୍ରମିନେନ୍ସ ଏରିଆ। ଏଠାରେ କ'ଣ ହୁଏ ନା ପ୍ରେସର ସୋର ହେବାର ସମ୍ଭାବନା ଥାଏ। କାହିଁକି ପ୍ରେସର ସୋର କ'ଣ ନା ଯେତେବେଳେ ବଡ଼ିରେ କ'ଣ ହେଉଛି ନା ଏ ବୋନି ପ୍ରମିନେନ୍ସ ଏରିଆ ଗୁଡ଼ାକ ବହୁତ ଦିନ ପର୍ଯ୍ୟନ୍ତ କୌଣସି ସରଫେସ୍ ସହିତ ଆଟାଚ୍ ହେଇକି ରହୁଛି କିମ୍ବା କିଛି ମଏଷ୍ଟ ସହିତ ଆଟାଚ୍ ହେଇକି ରହୁଛି ବହୁତ ସମୟ ପର୍ଯ୍ୟନ୍ତ, ତାହେଲେ ସେଇ ଜାଗାଟା କ'ଣ ହେଉଛି ନା ଅଲସର, ସେଇ ଜାଗାଟା ଅଲସର ହେଇଯାଉଛି, ସେଇ ଜାଗାରେ ଟିସ୍ୟୁ ଡ୍ୟାମେଜ୍ ହେଇଯାଉଛି, ତାକୁ ଆମେ ପ୍ରେସର ସୋର କହିଥାଉ। So to remove the pressure source or to prevent the pressure source, always change the position of the patient. Air mattress should be used and keep pillow between the knee and ankle. Then come the nutrition. So always give in the nutrition, always give the food or water in the head elevated positions to prevent the aspiration, the pneumonia. Okay, because if the in the head elevated position ରେ ବ୍ୟକ୍ତିକୁ କ'ଣ ହେବ ଫୁଡ଼୍ ବା ଫ୍ଲୁଇଡ଼ ଦେବା, କାହିଁକି ନା ଯଦି ଆମେ ନ ଦେଉଛେ ତାହେଲେ କ'ଣ ହେଉଛି ନା ବ୍ୟକ୍ତି ନିମୋନିଆ କଣ୍ଡିସନକୁ ପଳାଇ ଯାଇପାରେ। ନିମୋନିଆ କଣ୍ଡିସନରେ କ'ଣ ହେବ ନା ସେଠି ଫ୍ଲୁଇଡ଼ ଆକୁମୁଲେସନ୍ ହେଇଯିବ ଏବଂ ବୋଥ୍ ୱାନ୍ ଅର୍ ବୋଥ୍ ଏୟାର ସେକ୍ will be inflamed and fluid will be deposited. If the client is unable to take the food through the here the client is unable to take the food in the mouth, so that through the nasogastric tube feeding, NG tube feeding, we give the nutrients. So here we give the high protein milk drinks, fruit juice, water, etc. In the elimination pattern, the patient is unable to do the urinations and cannot pass and unable to go to the toilet to pass the stool. So we give the bedpan or urinals for the maintaining the elimination pattern of the patient, and observe the urinary retention and constipation. Okay, that is a patient observe the retention and constipation patient, by which we see that if the abdomen is distended, if there is a urinary retention and patient becomes restless. Okay, तो आम ऑब्जर्व करवा व्यक्ति पेसेंटर यूरिनरी रिटेंशन अच्छी कि नहीं, कन्स्टिपेशन अच्छी कि नहीं, केमती जानिबा ना व्यक्तिर इन द कन्स्टिपेशन और यूरिनरी रिटेंशन पेसेंट एब्डोमेन बिकम्स डिस्टेंडेड. ओके, and if the patient is constipated, then we give the suppository and observe the patient incontinence of urine. If it is there, inductive catheter is done. Okay, ଯଦି ବ୍ୟକ୍ତିର ଆମେ କ'ଣ କରିବା ୟୁରିନ୍ ରିଟେନ୍ସନ୍ କନ୍ଷ୍ଟିପେସନ୍ ଅଛି କି ନାହିଁ ଜାଣିବାକୁ ଚାହିଁବା, ତାହେଲେ ବ୍ୟକ୍ତିର ଆବ୍ଡୋମିନାଲ୍ ଯଦି ଡିଷ୍ଟେନ୍ସନ୍ ହୋଇକି ରହିଛି ତାହେଲେ ଆମେ ଜାଣିବା ଯେ ୟୁରିନ୍ ରିଟେନ୍ସନ୍ କନ୍ଷ୍ଟିପେସନ୍ ଷ୍ଟେଜ୍ରେ କ୍ଲାଣ୍ଟ ରହିଛି। ଯଦି ଆବ୍ଡୋମିନାଲ୍ ଡିଷ୍ଟେନ୍ସନ୍ ରହିଛି ତାହେଲେ ଆମେ ସପୋଜିଟୋରୀ ଆପ୍ଲାଏ କରିକି ଷ୍ଟୁଲ୍କୁ ବାହାର କରିବାକୁ ଟ୍ରାଏ କରିବା, ଏବଂ ଯେତେବେଳେ ୟୁରିନ୍ ରିଟେନ୍ସନ୍ ରହୁଛି ତ ୟୁରିନ୍ କ୍ୟାଥେଟରେସନ୍ ଆପ୍ଲାଏ କରିକି ରିମେନିଂ ୟୁରିନ୍ ଗୁଡ଼ିକୁ ବାହାର କରିବାକୁ ଟ୍ରାଏ କରିବା। display anxiety due to the hospitalizations, due to the hospitalizations, patient does not understand how he will or she will stay in the hospital, and he is unknown about that any type procedures are done. So patient becomes anxiety. For the reasons, the nurse should be nurse explain the procedure details to the patient to win the confidence and promote the cooperations. Okay. ତ ବ୍ୟକ୍ତି ଆଙ୍ଗଜାଇଟି ଷ୍ଟେଜ୍ କାହିଁକି ନା ଲଙ୍ଗ୍ ପିରିୟଡ଼ ପର୍ଯ୍ୟନ୍ତ ହସ୍ପିଟାଲ୍ସ ରହିଲା ଏବଂ ସେ ପ୍ରୋସିଜର୍ ପ୍ରତି ଅନନ୍ୟ ଅଟେ ଏବଂ ତା ଡିଜିଟ୍ ପ୍ରତି ଅନନ୍ୟ ଅଟେ। ତେଣୁ ଆମେ ଯେକୌଣସି ପ୍ରୋସିଜର୍ କରିବା ତାକୁ ଭଲ ଭାବରେ ଏକ୍ସପିରିଏନ୍ସ କରିବା, ତା ଭିତରେ କନଫିଡେନ୍ସ କ୍ରିଏଟ୍ କରିବାକୁ ଟ୍ରାଏ କରିବା। ଓକେ, ସୋ ଅନକନସିୟସନେସ୍ ଇଜ୍ ଓଭର୍। ଥ୍ୟାଙ୍କ ୟୁ।